Hi, Wilton.
Hello, how you doing?
Great. How are you?
I'm good. I just woke up and already ran into the office, ready to start working.
Perfect. Well, first, I just want to thank you so much for being here with me today. I know how busy you are, so we appreciate you taking the time for us here at ScanLabMR. So with that in mind, let's dive right in. So first, I think we should start by having you tell us a little bit about your program, about your role in that program, and what caused you to want to integrate ScanLabMR into it.
Oh, awesome, awesome. First of all, thank you so much for the opportunity to listen to us as the end users of the product. So prior to me taking over my role, which is I oversee the clinical education in our program, the directors, they were already looking for a product like this one for years. So when I came on board, we were already searching. So I'm going to tell you a little bit more about our program. Our program is a little bit over 10 years old, and our intake numbers is about 15 students to 17 students. That's an average every year. And due to the fact that our university is located in one of the biggest the biggest medical center in the world here in Houston, with all these big hospital, big names around us, you can understand the pressure to produce industry-ready, competent students.
Absolutely.
All these hospitals, they perform on a very high level, and they expect students coming from school who already know pretty much what to do. And that's where we started looking where we're deficient, and we wanted to incorporate something like ScanLabMR. Yes.
Okay, perfect. And for MD Anderson, for your particular program, how have you taken ScanLab and chosen to integrate it into your program? What has that looked like for you? Has it been difficult, easy? Tell us a little bit about your experience.
So for us integrating ScanLabMR into our program, it has been very beneficial because most of our students, they were staying home from COVID situation, and from that, we were having weekly Zoom meetings where they were expressing their concerns on how they don't feel confident enough to go back to the clinic and perform at the level they are performing. And that's when ScanLab came on board, and we were like, let's use this system. So ScanLab has to help them has increased their confidence in something we call patient screening, in which as a student, you don't know what is safe and what is not safe to go into the MRI, and your system really focuses on that area, which I can say is patient safety. We like that most. And then also some difficult and rare exams like wrist or extremity work. Some students, they've told me they were able to practice and prove their competency the following day using ScanLab. So that's why it has been very beneficial.
Great. So yes. As their guidance, as their teacher, have you noticed, obviously they feel more confident, but have you noticed that their skills have actually improved?
Okay, I can answer that question in two folds, because the first 2 semesters, they were using a different method of learning, that they were going to clinic and we were showing them anatomy in different way. But whether their skills have improved, I will say yes. I will say yes, because getting efficient on MRI console where they navigate and manipulate the slice prescription and playing around with so many parameters. Most of them, they've told me that they were able to correlate the information from ScanLab to the clinical practice, and they were able to understand better. Yes.
Fantastic.
Yes.
And so for other universities or hospital systems that are interested in using ScanLabMR, what would you say to them? What have been some of your pitfalls, your highlights, or some features in particular that you have found to be especially beneficial?
Oh, yeah. So for me, if somebody else was trying to get ScanLab and incorporate that into their program, I will honestly say, yes, go for it. That's number one, because it's going to benefit you at the end. One thing I can let them know, especially the stage that we are in ScanLab, is like they have to be patient. We were the first people to jump in and use the product. Sometimes you can get glitches. Any system can have glitches. I don't care which system. So that is where, like, I feel we were able to be more patient, and your team has been so excellent in jumping in and asking, what is wrong? What can we do? So that great partnership is what I can let them know they need to expect. You might see some glitches. Yes, you might. But it depends on the turnaround time, the relationship between the client and the developers. And it has been great. So that's what I can tell them.
Perfect.
Yes.
And I think I can tell by some of the other things that you've said, it sounds like you would definitely recommend other universities and hospitals to use ScanLabMR with their programs and their departments.
Absolutely, yes. Yes.
Awesome. And on one last quick question for you, because we know that you have had a good opportunity to get around ScanLab with your students and within the program itself. What's your personal favorite part about ScanLab? What's the thing that you love the most?
Okay, I have my number one favorite is the MRI screening form.
Okay.
Okay, I mentioned that again because we did not see a product out there that focuses on that area. And in MRI, that's an area that you have to know. Otherwise, you might hurt a patient or somebody. So that's one area. The second area, my second area at the same time is still like my favorite. Every exam that ScanLab have developed and created has 3 views, like axial, coronal, and sagittal. And if you practice and be able to acquire those 3 views on every exam, you should be able to be more confident when you go to the clinic. So I like that. And then the critical thinking questions at the end. I like those questions, like at the end, you'll see an image with a pathology, then you need to like think, what will you have done if you were in clinic? I like that because I don't like people who we used to call them button pushers. Do I need to explain who is a button pusher?
No, I've heard the term.
Yes, a button pusher is someone who just pushes a button and the image comes out and they don't even look at the image. They don't even think. So we like our students to be able to critique their work before the patient goes on the table, during, and towards the end. So I noticed ScanLab has the critical thinking questions where they will show you a disease progression at the end, and you need to decide what you need to do. Most of the time, we call the radiologist instead of letting the patient go, things like that. Sometimes you need to like notify your leadership. Sometimes you need to put the patient back in the room and do extra scans after you consult with the radiologist. So those critical thinking questions, I feel like they are probing the thinking of the students. That's another thing that I like. I know you asked me for one. I don't.
No, we'll take 3. That's perfect.
Oh, take 3. All right.
Awesome. Well, I think that about answers our questions, Wilton. I want to thank you again so much for taking the time to have this quick chat. We're really looking forward to hearing more about your students' progress again soon. Perfect.
As the clinical educator for my program, I'm looking forward to work with you more and more. And I'm expecting great things from your team. And thank you so much for this opportunity.
Thank you. We'll talk to you soon.
Talk to you soon. Bye.